views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good morning, everyone. Can I have everyone's attention? We'd like to get started. Good morning. Hello. Hello, hello, hello. Good morning, everyone, and I want to thank everyone for coming today. Another wonderful morning here in the Bronx. Let's begin as we usually do with introductions. I am Marika Scott McFadden. It just sounded like the volume went up when I said that. I'm the Deputy Borough President here in the Boogie Down Bronx. And to my left,
Tom Lucania, Director of Community Boards. Community Board 5.
Borough President Chair, Community Board 2. Morning, Rob Vice Mayor, District Manager, Community Board 2.
General Counsel for Borough President Diaz.
and here to my right in the audience. And over here in the audience. Okay, again, thank you and welcome to everyone in attendance this morning. We'd like to just jump in and get started. So pursuant to Chapter 4, Section 85 and Chapter 69, Section 27006 of the New York City Charter, a joint meeting of the Bronx Borough Service Cabinet and Bronx Borough Board will take place here today, Thursday, June 27, 2019, in the Rotunda at 851 Grand Concourse. And our first presenter that we'll have today is the New York Care's representatives that we heard from earlier, Dr. Ted Long, Vice President of Ambulatory Care, and Marielle Kress, Executive Director of New York City Cares, New York City Health and Hospitals Corporation. So please welcome them, and as they walk to our presenter stage. So this is a very interesting new project, pilot, and I think we'll all get a lot from it. Whenever you're ready. You're going to need to use the microphone, whether you sit or stand.
Hi everyone, thank you so much. My name is Mary Ellen. I'm the Executive Director of NYC Care at NYC Care Hospital.
And I'm Ted Long, I'm a primary care physician. I should be here in the Bronx to talk about the moment and I'm Vice President for Ambulatory Care at New York City Hospitals. Thank you for having us.
So we're here to talk about NYC Care. We're very, very excited. We're launching in the Bronx starting on August 1st, and we're here to give you an update and to get your feedback and your thoughts about how we can be most successful in the Bronx with this program to provide care to people who are ineligible for health insurance in the Bronx. So you may have known that the mayor announced his guaranteed health plan in January. This is an initiative to close the gap for people who don't have health insurance, who are uninsured. There are about 600,000 people in New York who are uninsured. Half of them approximately qualify for health insurance but are unenrolled, and that's the second option here for people who should be enrolled in health insurance who are eligible. And we have a great product called Special Plus, the New York's public option, which is a health plan that has all kinds of different service lines, from Medicaid to the essential plan to marketplace coverage. And so that's one piece of the guaranteed care plan. And the second piece is for people who do not qualify for health insurance, and that's NYC Care. So it's a new healthcare access option through New York City Health and Hospitals facilities. And it is not insurance. We want to make sure that folks understand that. But it is a really comprehensive plan to provide primary care and specialty care and other services to people in the Bronx and across New York City who don't qualify for health insurance. So the sliding fee scale that New York City Health and Hospitals has always had for people without insurance will still be there, but we're really building on that to make a really comprehensive set of services available for people. So we're launching in August in the Bronx. We're really excited. We're here all day and meeting with folks at our facilities later on today in Lincoln. And we'll have a footprint in all 5 boroughs by the end of 2020. So, I talked a little bit about this, but why NYC Care? There's lots of people who don't have insurance. Those people are either ineligible, largely based on their immigration status, or they can't afford health insurance based on the definition included in the Affordable Care Act. We have lots of folks who may come to us for emergency care, but not realize that, Health and Hospitals is now building up their ability to provide comprehensive primary care, and Dr. Long will talk more about that.
All right, so I'm again Dr. Long, and my personal clinic, I'm a primary care doctor myself. I see patients every week at our Morrisania Community Health Center in the Bronx. If I could get a show of hands, who here is familiar with the Morrisania Community Health Center in the Bronx? It's on Girard Avenue. It's not far from here. We have 7 facilities in the Bronx. We have a facility at Jacobi Hospital, North Central Bronx Hospital, Tremont, Gun Hill, Morrisania, Elvis, and Lincoln Hospital. But every week when I see patients, there's a few things that happen that we want to fix with this program that we've never done before. One is, as we sit here today, there are tens of thousands of people in the Bronx that do not have health insurance and do not get medical care. Why is that important? What is primary care? What do I do? So I'm the person that is your trusted doctor for you and your family. I'm the person that you come to over years, you bring your kids to, you come as a family, and when you have medical questions, if you have chest pain, if you have a variety of things, I'm the person that helps you to work through it so that you can be healthy and you can go back home. But I'm also the person in primary care that will make it happen for you to get colonoscopies to prevent colon cancer, mammograms to prevent breast cancer, diagnose diabetes, diagnose hypertension. If we don't do those things, we know people will not live as long, and we know people can develop cancer that you could have prevented by seeing me in my office or seeing one of us at one of our facilities. But as we sit here today, that's just not happening for tens of thousands of people right here in the Bronx. We need to fix that. So number one, we want to give them all, as the first line here, we want to give everybody in the Bronx access to primary care. Many have it now, which is good, but for the tens of thousands of people that don't, we want to fix that for them and have them know who their primary care doctor is, how to get in touch with them, and how to get all the care that they and their family need. If you call us to take it a step further, you're not going to wait months and months to see us, which has been the case in the past. You're going to wait 2 weeks or less if you've never seen us before. That's our commitment. You call us, through this program, we're building our capacity as we speak. We will see you or any family member that wants to come to us in primary care, wants to develop that relationship, and wants to get all those cancer screenings and preventive care. We'll see you in 2 weeks. We'll do all of it in 2 weeks. There's also a group of people in the Bronx, as we sit here today, also tens of thousands of people, that have some access to health care. They have access to the emergency department. Why? Because they have diabetes, they have hypertension, they haven't had those conditions managed, and if they would have seen me in my clinic on Fridays, I could have prevented them from going to the emergency department, but we didn't have that opportunity. Tens of thousands of people are relying only on the emergency department as we sit here today in the Bronx. Lincoln Hospital has the 4th busiest emergency department in the whole United States of America. We need to get people that are going to the emergency department, though, for things that could have been prevented if they would have seen me, to see me earlier, to keep them healthy earlier, to prevent them from having their diseases progress, to prevent them from having to rely on the emergency department, even if that's what they have now. If they call us in this program, we will see them in 2 weeks. Give them a primary care doctor that can be their doctor for the next 30 years. We'll do all of that within 2 weeks. There's also a group of patients that has come to, I mentioned 7 of our facilities. We see a lot of patients every year here in the Bronx. But even those patients, we want to improve the access for them to the medical care that they and their families need in ways that we've never done before. I'll give you an example of that. One thing right now is that for patients that are uninsured, one of the barriers for them is that medications are expensive, right? Medications cost a lot. So in our pharmacies at our facilities, 5 of the facilities I just named out loud have pharmacies that give patients without insurance a good discounted price based on however much money they make to make it affordable for them. But even with those pharmacies, we work real hard to give patients medications they need at a price they can afford, but we aren't open 24/7 because we're trying our best, but most of our pharmacies, we aren't open on the weekends, we aren't open at night. So this is one of those things that we want to fix for patients permanently, starting here in the Bronx in a way that we've never done before. As we sit here today, we're going to commit to, as of August 1st, anybody coming to us that does not have insurance in the Bronx, that lives in New York City, that's a part of this program, can get medications at that good price for them 24 hours a day. So that means the patients that had to go back to work, which happens to me every week when I see patients, who want to come back after work because that's more convenient for them, or after they pick up their kids. Current state, they can't get their medications at the special prices we've done for them. Future state, as of August 1st, they can get it them whenever they need to, whatever makes sense for their lives. We've never done that before. We're going to start it here in the Bronx August 1st. We think it's going to make a big difference. Other things are, right now, and I'm going to go to the next slide to show you the picture of this. Right now, if you come to see me in my clinic or any of our clinics in the Bronx, if you have insurance and you have a question, you have an insurance card, right? The card says what number to call for your question. How do I get to cardiology? What's this copay thing? How do I figure out what care makes sense for me and my family? Right now, if you're uninsured in the Bronx going anywhere, it's real hard to get those questions answered. And let me know if you've heard more feedback from people, but my patients tell me, who do I call if I have a question? And I don't have a great answer for them right now. However, we're going to have a great answer for them August 1st. We've never done this before, this is brand new, but we're setting up a 24/7 call center. With this card as your access to that, gives you the number to call on the back side of this card. So current state, it's hard to get your questions answered. If you're seeing me, you can ask and I'll do my best. But once you leave my office, it's hard to get all the information you need. 24/7, August 1st, you can call this number and you can get all your questions answered if you're uninsured in the Bronx. My patients tell me this will make a big difference to them, but let us know what you think of this. Also on this card, a couple other things to note. We're going to label right there up front and center, your primary care provider. Everybody that's part of this program will will know who their trusted doctor is. That's not the case now. It will be the case in this program. Then on the back side of the card, we don't have the number listed here because we haven't made it public yet, but we're going to make public that number you can call 24/7 to get everything you need, all of your questions answered. And also, we're going to do something we haven't done before too, which is, one of the things my patients tell me is it's sometimes hard to know how much they're going to have to pay to see me, or how much they're going to have to pay to see the cardiologist. It's important for them to know that. My patients want to be able to manage their finances, manage their lives, but it's a little bit of a black box in terms of understanding what they can expect to have to pay, even though we have a heavily discounted rate on a sliding scale in our system now. People want to know. People want to know ahead of time, and they have a right to know. They have a right to healthcare, and they have a right to know what's going to cost them. On this card here, the X's you see here on the left-hand side, we're going to print out, which is going to be different for every patient based on their income, exactly what you as a patient can expect to pay when you come to see me in primary care or see one of our specialists. We haven't done that before, but as of August 1st, when you get this card, you're going to know who your doctor is, you're going to know exactly how much everything costs from your medications, pharmacy, the last row here, to coming to see their primary care doctor or going to see a specialist. We think this is going to help to enable people to feel engaged with their healthcare and to answer them some of those questions that we know have been on people's minds for some time. We're going to fix it. Haven't fixed it before, we're going to fix it in this program. This program is going to bring transparency, much improved access for primary care, for medications in ways we've never even conceived of before, as of August 1st, fundamentally different. So that's what I want to talk about from a clinical perspective today. I'm going to hand it back to Marielle, but then we're happy we'd love to hear any of your feedback on this. We're happy to answer any questions.
Thanks, Ted. So I'm going to talk a little bit about what we're doing to get people enrolled in the program and outreach, and I would love your feedback about how to do this better and who to engage with, and whether you'd like us to come and do this for other groups that you engage with as well. So we are leveraging the investment in the city's Get Covered NYC initiative. We're working with lots of other city agencies and organizations across the city to leverage the enrollment work that's already in place. And part of the enrollment process that will go live on August 1st for people in the Bronx will be that they walk through the insurance application in order to be found ineligible and then enrolled in NYC Care. So part of the process that's baked in is trying to make sure that the people who are eligible for insurance are enrolled in insurance and know that they're eligible for insurance. So that's really how we're leveraging the Get Covered NYC initiative and making sure that people, know what they're eligible for and get enrolled in those programs if they are. We're undertaking a paid media campaign. This is really exciting for us. We have developed advertisements, messaging campaigns for people to have awareness, get the word out. We're doing ethnic media, WhatsApp, bus shelters, a subway station, taxi TV, you name it. We're going to get our message across and have people know that this access is available to them. They can come and have primary care and dignity in their care with us at health and hospitals. We're conducting targeted outreach in partnership with CBOs. So part of this is just one piece is providing resources to CBOs to do organizing and outreach. So we're working right now on selecting the community-based organizations that have a footprint in the Bronx to help us do that outreach, to knock on people's doors, to make them understand that this program is here for them. And then we're also we're hoping to develop a pathway for community-based organizations that are already doing this insurance outreach and enrollment work with people in the community to get a faster path to enrollment in NYC Care if they're ineligible for insurance. So not having a person have to go through that process of doing the insurance application multiple times. So that's one piece of work that we're doing with the community-based organizations here in the Bronx. And that's kind of the last bullet on this slide that I just walked through. So we just did a lot of talking, but we want to hear from you about how we can partner, what materials you need to get the word out, any questions you may have, considerations for the launch on August 1st, and And we really appreciate your time, and thank you for having us.
Do we have any questions, Ms. Brown?
Good morning. Thank you very much. Could you please step through what are the documentation? Thank you very much. Could you please step through what are the documentation requirements for eligibility and enrollment?
Sure. So the question was about what are the documentation requirements for eligibility and enrollment. So like I mentioned, the enrollment process will leverage the current New York State of Health insurance process. So a person will need the documentation that they would need to walk through the insurance application at the New York State of Health. And then if they are ineligible, if they don't have that documentation, the other eligibility requirement for this program is that a person must live in New York City for the last 6 months. And we are going to accept attestation for that piece of eligibility.
So people that are in shelters, formerly incarcerated, that's fine if they get a letter from their provider.
Yeah, if they tell us that they've lived in New York for the last 6 months. Thank you.
Oh, Mr. McManus.
I thought the presentation was very well, but I worked at Health and Hospitals for 13 years, and I'm retired 7 years now. The problem I saw with this is getting the people to come to their appointments. Many times in a month, 1 month I remember 70% of people didn't come to their appointments. So it's a great idea, and to keep people out of the emergency room, I understand it completely, but how are you going to do that? I mean,
Yeah, that's a great question. It's one of those, as you're pointing out, perennial issues that we've wanted to solve, but to date we haven't solved yet. But we have new leadership in New York City Health and Hospitals now. A year and a half ago, President Mitch Katz started. We've made a lot of changes since then. For example, one of the things that we've never done in New York City Health and Hospitals, raise your hand if you have a cell phone. Am I calling people down? Everybody has a cell phone. We've never texted people to remind them when their appointments are. If you go to a restaurant, they oftentimes will text you. So my patients tell me,
but I think the problem is not them forgetting.
Yeah.
Part of the problem is, especially with young families and children, they can't take a day off from work. Is there any, I should have rephrased the question a little bit more. You're going to have 24-hour pharmacy?
Yeah.
I'm not proposing 24/7 appointments, but that's been something that I heard would be a tremendous help to working families, because they're the people that really don't make the appointments. It was mostly with children.
Yeah.
So the parents are working, they can't bring their children. So I'm sorry, just to rephrase the question.
That's a great question. So what my patients tell me about that is that either they have to go back to work or pick up their kids at certain times, they can't come in to see me, or they didn't know that they had to be a certain place at a certain time until a week ago. Now they know, but they made their appointment 3 months ago, and now it doesn't work for them anymore. So we've never done this before, but we've started to do this at one of our facilities, and by the end of this year, we're going to be doing it at every facility, where instead of just having people schedule appointments 3 months ahead, what if we intentionally save the appointments for a week ahead of when patients want to be seen? That way, if you call us even a day, 2 days, or a week ahead, we've saved the appointments for you so that you can make the appointment when you have your schedule for the next week, as opposed to guessing where you're going to be in 3 months. We've started to do that at one of our hospitals now, and the effect has been very, very successful. People really like it. It enables them to navigate what makes sense in their lives. They make the appointment when they have their schedule, and they can actually make it to the appointment easier. The other things we've done as part of that is we now have evening hours, hours in the evening.
Okay.
And we now have Saturday hours as well. So I think those three things together, Saturday, evening hours, and really allowing patients to make or change their appointments when they have their schedules is better than setting an arbitrary time, 2 p.m. in 3 months.
One more thing about the phone. I know when I worked in a hospital, they had a phone that you'd call up with 20 different languages. when these people call that number and they don't speak the language, how do you communicate? You know, how do they communicate?
Yeah, we'll have the same technology that you just talked about, which is a translation line that the
Yeah, but if
call
they're
center-
calling from their home, how do they, you know?
Yeah, so there's a menu option when they
Okay,
call,
okay,
and
thank
it
you.
will say, you know, do you speak
Gotcha.
English, do you speak Spanish, or do you speak any other language, and then we'll access the language.
Thank you very much.
And just to build on that, I'm proud to say that in New York City Health Hospitals now, we have interpreter services for more than 150 languages and dialects. So we really are trying our best to engage with patients in the way that makes the most sense for them.
Thank you.
Mr. Torres?
Thank you. Good morning. My curiosity, in one of your slides, you mentioned that there are going to be fixed prices for the people that come to visit. So primary care visits, for example. How do you determine that? Are the doctors agreeing to set fees? I mean, I would imagine that they're already I guess destined to get that amount of money because of Medicaid or whatever the payout is, but how do you determine, or what are those fees going to be?
Thank you. And I actually was going to say this in the presentation because this is a question that I get asked a lot. So those fees will be based on the person's income and size of their household, so how many people live in their household. And the fees will actually be aligned with the fees that they would expect to pay if they had Medicaid, or they had the essential plan, or they had a marketplace plan. So if you're below 100% of the federal poverty level, most of those fees are zero. If you're in between 100 and 200, I'm making this up, but this is sort of how it works, then it will be $2 or $5. And so those are predetermined based on the person's income when they tell us when they enroll what their income and their household size is. And then we do some magic on the back end to do a calculation to put the $0, $5, $1 fee on the card. And so when they present, this will be the specific amount that the person has to pay. And it will be the same for everybody within that income range.
So I think that this is all very laudable, and I'm as progressive as they come, but I am a city employee as well. I have 2 young boys, teenagers. One is diabetic on an insulin pump, and the other has asthma. The reason I raise this is because as a city, we don't have our house in order. And yet, here we have a program, as laudable as it is, and I can see the beauty of it, because you don't want poor people or people to make decisions based on affordability. You have city employees that make decisions based on affordability. I am hard of hearing. Hearing aids cost $5,000. I can't afford it because my wife's union, DC 37, only gives her a $400 allowance. So are city employees going to be able to sign up for this? I mean, this is one of the criticisms that we have of Walmart, that in addition to getting a job at Walmart, they hand you a Medicaid and say, hey, fill this out and you'll get health insurance, and that's expected to be picked up by the federal government. Again, I always shrug my shoulders, and as a middle-class person, this is the sort of resentment that I feel, I don't want to speak for anybody else, that I feel when I see I have to pay $20 for a doctor's visit, $30 if I see a specialist. I have to pay for the lab work, that's another $15 or $10. God forbid I go for an emergency care, that's a $50 visit. If I have an overnight stay, that's $250 out of my pocket. I have 2 kids. I've experienced all of that. And yet here we are taking the most vulnerable and saying, yeah, your hospital visit will only cost $1. And again, I think that that's laudable. I just think you really need to get our house in order. Because right now, when the city negotiates their contracts, they're trying to extract savings from the unions, yet here we are giving it away, those savings, to somebody else.
I want to thank you, George, for your impassioned statement. I'm not sure that our presenters are ready to to
I
speak to
understood.
those.
This is not aimed at you, but this is aimed at having those conversations because, again, this is a very laudable program. Just like Thrive NYC was a laudable program. We wasted $250 million last year. I don't even know what this program costs, but I'm sure that when we review it next year, there'll be some deficiencies that we're going to talk about.
Just to give you a very quick response there, we can't speak to the city issues. Your points, we hear them.
Doctor.
But what I can say is, in all seriousness, we'd love to take care of your boys if you want to bring them by. We deliver world-class care. I can see them myself. Please let us know. We'd love to take care of you.
Well, there you go. Are there any other questions, comments, concerns?
Thank you, Madam Deputy. Good morning. You started the presentation by mentioning Lincoln Hospital in particular about emergency room visits. So my question is geared more towards trying to decrease the amount of emergency room visits, right? So where is the funding coming from this? And how are you going to gauge that you're going to decrease emergency room visits by the effectiveness of this program?
Yeah, I'm very excited about this question because this is really the crux of the whole thing. There are so many reasons why patients are going to the emergency department for things that could have been prevented if they would have gotten preventive care in the first place. I'm very passionate about this.
Right.
The way we're going to gauge that is we're going to look at measures of quality for how often they're going to the emergency department now, and if we bring them into primary care, give them the preventive care that they and their families need if they go to the emergency department less often. I am thoroughly convinced that they will. This has been studied, gives them the access to good primary care. They don't have to go to the emergency room.
Right.
We just haven't done it here yet. We need to do it. So that's why we're excited about this program. So we want to have them be seen in primary care so they don't have to go to the emergency room.
Right.
In terms of how the program is being funded, the program is being funded by the city to take care of the new patients that we haven't taken care of before, the uninsured patients that we'd enroll in the program. So, a lot of uninsured patients, like I said, go to the emergency department today. They might not have to if they just saw us for primary care in the first place. That's what we want to fix.
I
It's the
agree.
right
I
question.
agree. A follow-up question. Have you identified these high users of emergency rooms that do not have insurance?
Absolutely. Yes, so we have a flag that identifies who are people that use the emergency department more than other people, and it's actually a little more nuanced than that, but suffice to say, I agree that your point is right. We capture those people. What they don't have is they don't have primary care, so we want to actually be very intentional here to figure out what they need for us to connect them to primary care. Maybe it's we schedule an appointment for them in the emergency room. Maybe it's we call them the next day. Maybe it's we tell them what primary care is. I think it's a complicated question, but it's the question we need to answer. In this program, that's how we're going to see if we've been able to really move the needle. If people are coming to primary care so they don't have to get sick to go to the emergency room.
Right. So what tools of engagement are you going to use once you identify these high utilizers? How are you going to engage with them?
So right now, if you go to the emergency department, there is an effort to make an appointment in primary care with you, but a better way to do that would be to build out a care management system where we know we have somebody that goes up to you in the emergency department, sees how you're doing, sees what's going on with you. And actually, again, it's not an outside of the box thought to say, what if they made an appointment right then and there with the phone? I mean, we can do that. So the thing that this program does is it gives us the emphasis on bringing everybody into primary care. So that we can do things like schedule appointments right away because we are going to build our capacity to see everybody in 2 weeks. That wasn't possible before, but this program makes it possible now to actually get people into primary care.
Okay.
Your questions are all right on.
All right. Good luck. Good luck
Thank
with
you.
it.
Yes, it's all.
Right. So Ted talked about the 24-hour customer service line, and that is the portal into getting people enrolled in this program. So if you call the customer service line, which speaks many, many languages for people, you can get connected to a financial counselor who will screen you in person to make sure that you're not eligible for insurance first, and then enroll you in NYC Care. But what the call center will also do is talk to you about what kind of primary care provider you want. So they'll talk to you about what language you prefer, whether you prefer a man or a woman, what location you would prefer that's close to your house. So they work with people to identify the right person to create that relationship with. And then on the phone, once they've developed that, set of criteria for the person and picked the primary care provider, they make that appointment for you. And they promise that appointment is within the next 2 weeks from the time that you enrolled. And so that is the direct pathway to get to pick that person who's right for you, to manage your care and give you that care, and then also on the spot make that appointment for you as well.
Okay, thank you everyone. We want to thank our presenters from New York City Health and Hospitals Corporation. Thank you so much for coming in today.
Thank you very much.
We're looking forward to hearing more in the year to come about the results of the New York Cares, and we invite you to come again and give us the results of the pilot program.
Sounds great.
Thank you. I think our next presenters, we may be somewhat familiar with. It's a little bit of Bronx Week 2.0. We were lucky enough to be able to honor some of Make-A-Wish volunteers and their efforts during Bronx Week this year in our traditional volunteer celebration, which is held just before the Walk of Fame inductees. So I want to invite Erica to the podium / area to talk more about Make-A-Wish Foundation. And I know that Make-A-Wish is something that many of us have heard of, and I think Erica's going to give us some new information. So let's give her a couple of minutes with the technology to get her presentation up. And let's just give her like 5 minutes or less.
Thank you. I'd like to thank the Borough President for all of his support and his whole team. Thank you very much. We have been very honored and privileged to be in the Bronx with the leaders of the Bronx and really ensuring that our kids get the wishes that they so deserve during a very difficult time. My name is Erica Sandoval. I'm the Director of Medical, Volunteer, and Community Engagement for Make-A-Wish Metro New York. We do have slides printed out, so please feel free to follow along. Today I'd like to share a little bit about our mission. I'm going to show a short video. I will also want to give you information on how you also can be a part of granting wishes for our kids in the Bronx and the volunteer process. And I want to give you a couple of stories, some really success stories that come from kids in the Bronx that recently had their wishes granted. Our mission has changed. Prior to this, we would grant wishes to kids with terminal illness. Then it changed to we grant wishes to kids with life-threatening illness. And now we're creating life-changing wishes to kids with critical illness. The reason for this is that there has been advancements in medicine, so our kids are living longer, fulfilling lives, which is amazing. And we really wanted to ensure that all of our kids that are identified are being deemed eligible for a wish. And the misconception has been that it's only for kids with cancer, it's only for kids with terminal illness, and that's not the case. It's for kids that are going through a very difficult time, that are going through surgeries, organ transplants. Yes, cancers are definitely one of our top symptoms diseases that kids are having that we grant wishes to. And unfortunately, kids in the Bronx are identified a lot more because of the disparities that there are in the different boroughs. And we are partnered with Montefiore Health System, which is one of our top referring hospitals that treats our kids. So guess what? We have more kids in the Bronx that are deemed eligible for wishes. Thus, we need more volunteers. The misconception also has been is that staff grants wishes. So once the kid is identified and they are deemed eligible, the thought was that kids would then be interviewed by Make-A-Wish staff, and that's not the case. It's actually volunteers within the community of where they live. Volunteers that can go into the bedside of the hospitals or visit them at their home and really explore what the wish would be. I'm going to show a short video of a really, really amazing wish. Okay, if it's not working, I'm going to keep moving. I'm not sure if it's going to work due to Wi-Fi, but I'll tell you the story. There was two kids that were in an adoptive agency in China, and one of them was adopted to parents in the U.S. When he reached the U.S., he had surgery for a very, very, very difficult cardiac condition. When he was identified for a wish, 3 years later, his wish was to go to a Disney cruise. But he didn't just wish to go on a Disney cruise. He wanted to be reunited with his friend, his partner from China that was also in the agency. And the wish was granted. And they reunited after 4 years. And the impact that had on him and the family and the community and the other child was amazing. This is how thoughtful our kids are when they're thinking about wishes. They're thinking about things that they are wanting and needing and that can impact them in a positive way. And you may think that a trip is something that's so frivolous, but it's not. It's a way to get control of your life back when you have no control because you're going to doctor visits, you have to take medication, you have to have surgery, and there's this one thing that you have control 100%, and that is, what are you hoping to have? What is your wish? And that's the beauty of it. It helps them build confidence. It helps their self-esteem. And research has even shown that it has reduced hospitalizations. We had research that Dr. Patel has put together, which is our national medical advisor, on a cohort of kids, and it showed that when they were interviewed for a wish, their hospitalizations decreased and adherence to treatment increased. Why do you think that is? The thought of the fact that they had something to look forward to really inspired them, empowered them to continue and push through. And that's one impact that a wish has on a child. But what I want to say more is the impact that it has on the community that serves these kids. And we could not have done this without our support. The process is very simple. You first volunteer by applying to become a volunteer and filling out an application. We no longer have to go through a paper format. We have forms that will be passed along. You can just scan it and you can start typing your information. It gets put through to the Make-A-Wish office. Then you work with a staff person or a volunteer from the Make-A-Wish office, and they talk to you about what are some of the things that you might want to do with Make-A-Wish. They really try to identify your skill set. If it is wish granting, they will invite you to a wish granting training. We'll resume in the fall. Once you were trained, you get partnered with a volunteer, another volunteer that has been trained. There is a background check that you have to clear. Once you get partnered with that volunteer and you're cleared with the background check and you have had that training, you get to meet your child. And once you meet your child, you really explore what type of wish they would like to have. Does anyone know anyone that has a wish granted here? Has anyone applied to be a volunteer here? It's amazing. I myself am a volunteer. I have granted about 14 wishes to kids in the Bronx. And the reason I take kids in the Bronx is because there's a lack of Spanish-speaking volunteers. And I noticed that kids in the Bronx that speak Spanish were waiting longer, waiting 9 months to just be interviewed. So I made it a mission of my own to invite friends and family to really partake in this and making sure our kids are interviewed. Once they are interviewed, we take that packet, we give it to the Make-A-Wish staff, and they start going through the process of making sure it's a safe and appropriate wish, and the wish gets planned by the staff, and then the volunteers go back to the home and reveal the wish, whether it is, I wish to meet Steph Curry, or I wish to be a model, or I wish to go on a trip with my grandmother, or I wish to be a police officer. Depending on that wish you're going to reveal, when that wish is going to take place, you give them all that great information and the news, and you get to be part of that experience. We had 2 amazing volunteers speak on the impact that the wish had on them, and there were 2 wish moms. One lost her child, and she said she does this in memory of her daughter. Another one continues to push through because she knows that each wish is very unique, and it really creates a monumental, life-changing moment for not just the child, but the family and the siblings and the community that supports them. So in the Bronx, in March of 2019, 203 children from the Bronx were in the WISH process, and 79 of them were ready for a volunteer assignment. Bronx volunteer pool increased from 36 volunteers to 59 from March 2018 to March 2019. Currently, there's 185 children from the Bronx that are in a WISH process. That means they're either referred, deemed eligible, ready to be assigned to volunteer, or even waiting to have that wish granted. Thanks to our current volunteers, out of 185 children, there are only 13 kids in the Bronx that are waiting to be interviewed for a wish. And this is due to the support of our Bronx community. We built an amazing Bronx Community Council. Tracy McDermott, who is here today, represents our Borough President, Ruben Diaz Jr. Please give us a round of applause. This is incredible when this has been the borough that has been so vulnerable and high need. Look at what we did together. So we know the numbers. From March now, 2019, 79 Bronx kids were waiting for volunteer assignment. June, as of today, there are 13 kids that are waiting for volunteers. So what I'm saying now is I'm challenging and I'm asking and I'm pleading with all of you to still get involved, because we have 71 kids that are in referred status and also deemed eligible. So we still have kids that are being referred to Make-A-Wish. Why is that? Kids are still not doing well. Kids have critical illness. Though our kids have been served that have been waiting, we continue to reach more kids. They're still in need of volunteers. So our goal is, by 2020, is to have 100 Bronx volunteers of diverse communities, diverse boards, diverse languages, so no kid ever waits in the Bronx to have a wish granted. This is a picture of our Bronx Community Council. We had a wonderful event during Bronx Week where we honored them and introduced them to our volunteers. This is a picture of one of our kids that recently got go my Alina was displaced after Hurricane Maria, and she came to New York City and stayed with family in the Bronx, and she was going through a very difficult time. She also had a cardiac condition, and during that time, I met her on Christmas Day at a shelter with her family because they had nowhere to celebrate. And I was volunteering that day, and her mom told me that she was in the process of having a wish granted in Puerto Rico, but the chapter in Puerto Rico was dismantled, and they were not able to grant her wish. So we granted her wish. It took some time. We met with her, we found out what it was, and it was for her to go on a cruise and meet all these princesses. And she still sends me pictures today. They rebuilt their home now, and she still says how important that wish was to her, because during that devastating, traumatic time, she had the wish to look forward to. So take in consideration all of these kids and what they're going through and what the wish means to them, and I am sure that you're gonna have a meaningful experience as well. Thank you. Does anyone have any questions I can answer about the process?
Any questions? I just want to drive home the points that that Erica made in terms of the Bronx being very diverse in languages, cultures, and religion, and how important it is to that we reach out into that they have volunteers that can reach out into all of these different and diverse areas and be able to not only find folks that need wishes to be granted, but then also volunteers that can meet them where they are, especially when it comes to language and culture and things like that. So as the borough president often says, the Bronx is God's country, and we love to participate in God's work, and I hope that everyone will take the message. I hope that we don't have any questions, because we know that we've heard the call to action, and we'll then take that into your community boards. And maybe, Erica, you can speak to how they can reach you in terms of maybe making an additional presentation.
Sure.
Or any
Yes.
other outreach.
I can provide my email. We also have on those one-pagers that are being handed out for, you can apply and you can call our toll-free number. But my email is esandoval, Sandoval, SANDOVAL @metrony.wish.org. And I'll be happy to hand out my business cards after the meeting. Thank you.
Hi, everybody. I just want to add on one thing. So each of these wishes requires 2 volunteers. So that's very important. One volunteer cannot go visit the family. It takes 2 volunteers. But I will tell you, I went through the training. I just did my first interview with a 50-year-old child, and it is a very interesting process, and we're hoping that his wish comes true. He's requested to meet his hero, LeBron James. So, and it's just a worthwhile experience. You can see the smile on his face, and also the family that's been dealing with the issues of taking the child to the doctor, and just seeing how excited the child is to kind of go through this process. So, and it really does help with healthcare outcomes. So thank you. And please, if you're not able to volunteer, please talk to your board members and your community about how to get to volunteer. Thank you.
Thank you, Erica. Thank you for the presentation. So we have another bit of a business, which again I'm calling Bronx Week 2.0. During our community board dinner, which we had during Bronx Week, we had an opportunity to, of course, fellowship with each other and be together as a community board, and I want to encourage everyone to participate next year when we do the same thing. But we also had an opportunity to honor and celebrate our women community board chairs. So all of the women who had community boards, which at the time we had 6. We had 8. No, 6. Why does that say 8? Oh, okay. Well, I'm gonna get it together. I wasn't a math major, but we had 6 women, which represented 50% of our board chairs, which we were awesome and happy to have that number. And unfortunately, one of our chairwomen was not able to be at the dinner, but we promised that we would have the opportunity to present this to her today. So this proclamation is in honor of Chairwoman Kathleen Saunders. And Ms. Saunders was appointed to Community Board 4 in 2003 and became chairwoman in 2013. Ms. Saunders is a retired administrator at a telephone company, a longtime Concourse Village resident, and has in the past served as president of the Co-op Board and Co-op's Board of Directors. So we know that she has a wonderful, wonderful history in the community, and we know that she will continue to serve the community. Please come up and get your proclamation. Take your time. Oh, sure. So, a little housekeeping. We want to acknowledge 2 new chairpersons who are here today. Community Board 7's Emmanuel Martinez. Please stand. And Community Board 10, Mr. Joe Russo. And we know the challenges that occur with this great volunteer position of a community board, and the service that you give is appreciated. So I'd like to also give a hand to our Community Board 7 Chair, Jean Hill. We want to thank her for her service. I guess that is the part of our program that would be the new business. I just want to also make an announcement. I know most of us are aware of tonight's fireworks demonstration. The New York Salutes America, where Borough President Diaz, and in conjunction with Councilman Jonai, presents the New York Salutes America with fireworks demonstration. That's going to be held this evening at Orchard Beach at sunset. It's open to everyone. The beach is a great time. There's music, there's entertainment, and you can view the fireworks from the beach. So we want to encourage all families and to come out. It's a great time. I'll now open the floor to any other announcements that the board members have, Anything great happening in your board that you'd like to discuss? Okay. The audience, do we have anyone in the audience that would like to who would like to make a comment or have an announcement? Okay, I see it's summertime. Everybody's looking to move ahead to their summer plans for this afternoon. So I will adjourn this meeting. I thank you so much for coming. And our next meeting will be July 10th, 2019, which is a little different from our usual schedule. But I just want to remind you all, we will be seeing each other soon. July 10th is the next meeting. Okay, thank you so much. Thank you for coming. Travel safe.
For those that are coming to the